For joining us. Today is Tuesday, April 20th. We're going to start today's QC COVID-19 press briefing. With us today, we have Janet Hill, Chief Operating Officer with the Rock Island County Health Department, and Amy Thoreson, newly appointed Director of the Scott County Health Department. And we have some community partners who have been gracious enough to join us today to talk about COVID vaccine in our communities. We have Pastor Steve Perkins of Bethel AME Church in Davenport, and along with Robertson, the Vice President of the League of United Latin American Citizens, LULAC, Council 10 in Davenport. Today we're going to start with our case counts from both Rock Island and Scott County. So let's go ahead with Rock Island County first, Janet.
Hi, everyone. Today we are reporting 26 new cases for a total of 14,067. The average age, and this has been a trend for several weeks now, is 31. We have 15 people in the hospital. We have no new deaths to report, so we remain at 311. Our county's positivity rate is 5.3%, and our regional positivity rate is 6.9%. Just a reminder that any mitigations that would happen would be at the regional level, and those could be triggered at 8%. So at the regional level, we are closer than we are at the local level. Thanks.
In Scott County, there have been a total of 20,534 tests that were positive for COVID-19, and we are currently at a 9% positivity rate for Scott County. There have been 235 deaths due to COVID-19 so far in Scott County. We too have seen younger ages. In terms of vaccine, 116,909 doses have been administered by Scott County providers, and 49,964 Scott County residents are fully immunized at this time.
Now we'll hear some prepared information from Rock Island County.
So let's start off with some great news. To date, more than 82,000 vaccine doses have been administered to Rock Island County residents, and almost 35,000 people are fully vaccinated. Across Illinois, more than 50% of adults have received at least one dose of the vaccine. For months, we've asked you to be patient and wait your turn to get a COVID-19 vaccine. Your time is now. This week, we have many appointments open at our mass vaccination site at the Camden Center in Milan. Hours are 8 a.m. to 4 p.m. Monday through Saturday, and making an appointment is very important because it helps us plan how much vaccine will be used each day at the clinic. You've heard us talk about how the vaccine can be stored for only a certain amount of time. Scheduled appointments allow us to prepare only what vaccine will be used so that we will not waste a single dose. Because of this, walk-ins usually will be turned away because we have a limited number of doses planned out each day. To sign up for an appointment, you can visit richd.org or the Rock Island County Health Department's Facebook page to get a link and a voucher code to the clinic date you need. You will need to present your QR code at the clinic, and you'll receive that after completing registration. Once you see this appointment calendar notification, you must scroll down and hit the submit button. The appointment is not made until you click the submit button. You will know you have made the appointment when you receive that QR code. You also must make an appointment in the same way for the second dose. You don't have to get your second dose at the Camden Center. If another day or time is available and within your second dose window, go ahead and take it. Our pharmacy and healthcare partners have weekend and evening appointments available. To find locations, you can visit coronavirus.illinois.gov or vaccinefinder.org. We also this week have a special Pfizer clinic opportunity tomorrow, Wednesday, at our health department at 2112 25th Avenue in Rock Island. To sign up for these clinics, you also can visit richd.org or our Facebook page. There are many slots available. And as a reminder, only Pfizer has been given emergency use authorization for children ages 16 and 17. We will vaccinate those who need both the first or the second dose. And speaking of doses, at your first dose appointment at health department clinics, you will be given a vaccination card. You must bring your vaccination card to your second dose appointment. You could be turned away without it. You can come back later in the same day and we will honor your appointment. And just a little note, before you arrive at your appointment, please make sure that you eat something and drink water before getting your vaccine. We've had some people faint if their blood sugar is low or they are dehydrated. And one last reminder, while almost everyone is focused on getting vaccinated, we still are in the middle of a pandemic. And widespread vaccination will get us closer back to normal, but is only one of our tools to prevent more infection. Even if you've been fully vaccinated, you must continue to wear your mask and keep 6 feet from others in public. We know you are tired of this pandemic, and trust us, we are too. Please help us end it by getting vaccinated as soon as you can. Thanks.
There have been enough burdens experienced during the COVID-19 pandemic to go around. However, individuals in communities of color have borne a larger portion of this burden. All illness, such as COVID-19, is more likely to severely impact those with underlying health conditions. According to years of data, African American and Hispanic individuals are unfortunately more likely to have underlying health conditions such as heart disease, disabilities, asthma, and other risk factors. We also know that access to care, including vaccines, is lagging in these communities. Pair those issues with the fact that individuals from African American and Hispanic communities are more likely to work in frontline jobs where the ability to work from home or avoid close contact with others during a pandemic is limited, and you have communities of color bearing a larger burden. One way to help ease this burden is to provide information about the vaccines that answers the questions we have heard individuals ask. These answers are available right here in our community, and we will keep sharing sites and sources of information. The Greater Than COVID video series that we have placed on our website is an open and honest conversation about COVID-19 by physicians from communities of color for individuals from communities of color. However, we can all learn from these experts. We are working to do more locally as well. We continue to rely on community partners to share COVID-19 vaccine information and to share their experiences in getting vaccinated. With us today are two of those community leaders who have taken the steps to be vaccinated and are with us to share their stories in hopes of encouraging others from our community to get vaccinated too. Thank you both for partnering with us on the important topic of vaccination today.
Thank you, Pastor Perkins and Toni, for joining us. We're grateful that you're here. As both Amy and Janet alluded to, COVID-19 vaccine is just an extremely important tool in our response to the pandemic. And even though many in our community have suffered, we know it's going to take a lot of work to get widespread vaccinations in our community. So we're glad you're here to have these conversations with us. We prepared some questions for you, and we're hoping we can just have an honest conversation and get some feedback and some information to share broadly with our community. So first, I'd like to just ask each of you, can you speak to the impact the pandemic has had on members of your community? Can we start with Pastor Perkins? Can you just describe to us what you've seen and what you've been helping your community deal with at this point?
Well, thank you so much, Brooke Barnes and Amy and Janet, and to the rest of the team. Thank you for this time of sharing an opportunity. The pandemic here has been really tough on the African American community. Of course, we know, and thank you, Amy, for mentioning it, the disproportionate number of rate at which the African American community has been vaccinated. Things that I've discovered that really contribute to this is the likelihood that because of the fact that they live in poverty, they reside in neighborhoods that are overcrowded in their households, inadequate health care, and all of that. And so one of the things that it has really taken a toll. And so that's why I'm glad we're having this conversation so that we could help and I know Tony's going to speak to that, so that we could help not only the African American community, but the Hispanic community as well. But again, it is devastating to the African American community. That's why I'm appreciative to be able to partner with Scott County Health Department, the CHC, and others to try to do all that I can to help our communities of color to get vaccinated and to help them with this whole knowledge of vaccination.
Toni, what have you been seeing in terms of the impact of the pandemic on members of the community?
A lot of the impact that we have on our community is, as Mr. Perkins said, that unfortunately the poverty level is huge at risk. And we, as Hispanics, carry a lot of the underlying jobs. As we all know, the meatpacking plants were hit very hard. The situations there were close working facilities and everybody was on top of each other. It's a job that is necessary. And there was, you know, the Hispanics were afraid to even speak up that they had an illness because they didn't want to lose their jobs. Yeah. The same way with our in-town communities, day-to-day people. They don't speak, they don't talk about things. They're so worried that so many of them, they're undocumented. They won't speak up because they don't want to be deported. And they think that if you know, I come out and you know who I am, I may have a chance of losing my family. So with this type of thing, we as LULAC, we are a national organization. We do have a lot of outreach to the community. We try to inform them as to where they can get vaccinated, how, if they need any help, they can call us. We have bilingual people that can help them. Language is such a barrier. Other than that, we're just trying to help as many get vaccinated as they can.
So right at this point, what have been the conversations that you've been hearing around vaccination when you're out in the community, whether you're trying to promote it or just it comes up in a conversation with a friend or a member of your congregation or a member, you know, one of your members there? What's that conversation been like so far about the vaccine?
Well, some of the conversations center around the whole vaccination itself, because we are at high risk of infection, and so and the conversation I've had with several people over the last couple of weeks is that first, let me go to the doctor, let me make sure that that everything is well with my body before I take the shot, and so high risk of infection. And they also deal with, like I said, deal with their health challenges and risk. Also, because they have fewer resources to healthcare providers, and because they don't have doctors or they don't even have healthcare at all. And I know that healthcare is provided and there are ways to get healthcare, but some of them, the reality is some of them don't have healthcare. And so when they talk about this vaccine, part of the question is, how much does it cost? Does it cost me? And their relationships with their providers, if they go and when they go. And they also talk about not having a suitable way of transportation to get to a vaccination center. So those are just some of the conversations that I'm having and that we're having that deals with the vaccination clinic. What's in it? What makes up the vaccine? And because they look at, because it was such a quick turnaround. One day they had the vaccine, the very next week the FDA or they approved or whomever approved the vaccine, and then all of a sudden start sticking it into the arms of people. So those are just some of the conversations.
Toni, are you hearing some similar conversations when you're out and about and and talking with some of your membership?
Well, unfortunately, because of the pandemic, we are really not out and about a lot, whereas pastor, he has a congregation that he is in front of. We just have our memberships, of which even our monthly meetings, we may have 6 or 8 people show up just because of the interaction. They don't feel comfortable yet coming out and mingling with people. So as far as me, myself, talking and seeing people, I don't see it. We, as I said before, we communicate through the computer. Unfortunately, probably a high percentage of the people don't have computers. They can't see. We don't get, in the newspaper, so we can't talk to them through any kind of media. And it's just kind of a word of mouth. Is we tell, a Hispanic community is very tight. So if you tell one family, they tell another and another and another. So that's basically how it gets around, but you don't get feedback because you were not the one that talked to them.
Right.
So we have received some calls and wanting to know, where, how, what do I do? And I can't, and I don't have. And so we're trying to find resources for them. And as Mr. Perkins says that, healthcare is a big issue. Like when I got my vaccine, they want to know who my provider was. I don't know what they do with people that don't have a provider.
Right.
Do they give them the shot? Do they, what kind of questions do they ask? Unfortunately, I'm not privy to that because I do have healthcare. So I can't help them. I can't answer that question for them. And so anytime we run, into a roadblock, we go out and we try to find some more answers for them, or we tell them where to go. We have the Esperanza Center in Moline that really works with the Hispanic community, both sides of the river. So if they know a lot of the hardcore questions. So that's.
So you did mention getting your vaccine, and Pastor, I know you've received at least 1 dose of vaccine, if I remember. Both. Okay. And I know, trust is such an important factor for many in any community. Do you both want to speak to sort of your decision or your reason behind getting vaccinated as a way to maybe implore on others who might be, have similar reasonings behind being interested in being vaccinated? You want to start, Pastor?
Well, I've been vaccinated, and I'm past my 2-week fully vaccination period. For me, it was not about the shot in my arm after the vaccine. For me, it was about now that I've got the shot, that I feel free for the first time in a whole year to be able to move about and not necessarily unmasked, but now I feel like I can move about. I can feel so much freer because I have been vaccinated. Not saying that the vaccination, now that I'm vaccinated, that now I can go out and travel the world or do this, that, and the other. But I feel freer, and I feel hopeful for the first time in that way. Every person deserves the chance to live a healthy life, and that's why being vaccinated for me is so important. Is because every person deserves to live the chance to live a healthy life. And that's why this whole thing is so important. I appreciate what Toni said earlier. Is that just to Brooke, if you don't mind, just a quick second. That when I went to get my vaccination, I was asked about my health, about if I had health insurance, and I did. There were some who didn't, and they did not turn them away, at least from the African American standpoint. They did not turn them away. All they did was simply answer, go through it, and they went on about it, and they let them get their shot and move on. And so when I'm having these conversations, I'm telling them that, hey, I got vaccinated because it gives me hope. It gives me a sense of freedom. It allows me to be able to go out and tell others the importance of getting the vaccine. So that's where I stand with that. I stand pat on that. And Brooke, you and I have had several conversations, of course, Janet as well, but it is very important, and that's why I got vaccinated, and that's my reason for why.
And Toni, I think you've said you've had your first dose, correct?
I actually have had my second dose because of the delay of the meeting, the interview.
Oh,
I did the
okay.
second dose, and I'm 1 week into the 2-week segment that you have to wait. And I too, same as Pastor, I was glad to get it because I do want to move more freely, mask worn at all times, be able to interact with people, have family gatherings again. There's, members of my own particular family that, I mean, they stayed in place. They were uncomfortable even leaving their home. I personally went and bought my own groceries and, did things like that. And so I still interacted with other people at distancing and stayed safe. Thank the Lord. I did not have COVID, and I am very thankful for that. I do know many close family members and friends that did have it, some not as bad as others, but it was cruel. It was a crucial disease. I feel for anybody and everybody that did have it.
Brooke, if you don't mind,
Sure.
based on what Toni was talking about her family members,
Sure.
my uncle was in the hospital for 4 months with COVID. Then he went from there and spent 3 weeks in a nursing home. Now he's at home. And so I know the importance, and that's why I have reached out. Thank you, Toni. Reached out to my family and have been imploring them of how important it is to get the vaccine. And I'm actually headed to home for the first time in over a year to see family members. As a pastor, I have experienced being out during the entire pandemic. I can't tell you the countless number of funerals that I did around the Quad Cities. I probably averaged, and not all of them were my members. Some of them were other people's members who asked me to do them. Some people knew of me and asked me to do them. I probably averaged 3 funerals a month at least. And probably better than 90% of them was due to COVID. And so that's why I'm speaking truth to power as to why I did it and why it's so important for others.
Thank you. That's a very powerful message. I do want to kind of sum up some of our questions because you answered a couple of the others that I had, but really,
Sorry.
No, that's perfect. It flows very well that way. As you look to the future, and if we are able to see, many members of our community make that choice to get vaccinated, what are the benefits that you're expecting larger members of your community or larger numbers as a community to get from being vaccinated down the road? Sometimes it's that powerful of, forward positive thinking. What's it going to look like if we're able to really get some of those high numbers, and how do you use that to encourage your community?
Go ahead, Toni.
I think it will, as we all know, a lot of our open things like the BICs and our events are starting to come back. I know the riverfront is getting booked. And I think with the vaccination coming on strong, that will open up our community. That will kind of rejuvenate what we are, who we are, and where we're from. I hope that everybody still does it respectfully and is conscious of other people around them. Not everybody wants to get out, but not everybody is still as comfortable as some. So we need to still be mindful that there is a disease out there. We have shots, and we hope that it works and that it keeps us safe. But even like the influenza shots that we have been getting for many years, there are still people that catch it, even though they've been vaccinated. COVID will be the same. We will get vaccinated. There will still have people that will come down with it, but we still need to be respectful of people and their wishes. If they don't want to be around you, don't force yourself on them. Respect them, respect their wishes.
And I agree with you, Toni. I know even for my own church, Easter was the first Sunday that we opened back up. Although it was nice weather, we decided to go outside and have services outside. But that second Sunday, we did come back in the building, and so where I saw about 100 or more people outside on the first Sunday, when we came back in the building, we only saw about 17. And then on this past Sunday, we went up to 23. And so it is working, it is climbing. Those persons, all of my persons have been vaccinated. All of my persons are wearing masks still. We're still doing the social distancing. And so but I do think that there is more that we could do in terms of the larger number and being a relief for them. What can we do to further do it? And I think that we need to do more, because there are still people who are hungry, who still are not at work and still don't have the money to buy food, or still don't have the health care. And Toni and I have referred to for the Black community and the Latino community. There's still, I mean, I know that there are jobs out there, but people are being nervous because they feel like they'll go to work this week, something will happen, and then next week they won't have a job. And so I still think that there is more that we can do. Yes, the community is coming back. Yes, our state is coming back. Yes, our country is coming back, which is a wonderful, wonderful thing. But I do think that there is more that can be done, and I am endeavoring to continue the fight to get more food into homes. I've got a food program I'm getting ready to do here, and Toni, I'll get your information, because I'm going to be distributing food. But there to anybody who wants to get it, Black, white, Hispanic, no matter whom it is. So yes, our community is coming back, but yes, I think we still need to do more.
Well, thank you both for your time talking about all of these important topics. We hope to continue these conversations. We hope to keep connecting people to vaccine on the Scott County Health Department and Rock Island County Health Department's websites. There's links there. We know people can call 211 here in Iowa to get access to appointments. So we're committed to continuing to work on that. If any of our media partners have questions for either Toni or Pastor Perkins, please type those into the chat now. We did get one question that came prior to the event. It's for Amy. And this is about Iowa expanding vaccinations to those 16 and under. And really, FDA did with the authorization for Pfizer vaccine. And then Iowa expanded to everyone who was eligible about 2 weeks ago. Do you have vaccination numbers in the 16 to 18 age range, either doses administered or fully vaccinated?
We're able to see doses administered. And so for that 0 to 17 population, now we know 16 and 17-year-olds are the only ages in that grouping that are able to receive the vaccine right now. There have been about 1,000 vaccinations given to individuals in that age group. We don't really have a good number on first doses, second doses, but knowing that the bulk of those were likely after it was approved for them, we're hoping that a lot of those are first doses, so that we know the numbers will be even greater when those kids get fully vaccinated.
And the follow-up question to that was, what is Scott County doing for outreach to get older teenagers vaccinated?
So we have calls with the school leadership every other week. And so we've been talking with them about vaccine messaging and sharing resources for them. We've been sharing some information on our website, encouraging kids that participate in extracurricular activities, save your track season, save your soccer season, don't be quarantined, and trying to target them that way. And I know some of our partners have been working with the school districts to reach out and see if they could make arrangements for a high school night or something like that to come to their clinic location. So there's definitely a recognized need to get those youth vaccinated. And so we're all continuing to look for ways to make that possible.
Hey, Brooke.
Yes.
If you don't mind, onto what Amy just said, and I think that, because since we're doing this little segment via Facebook / on, the television networks, I do think that it is important that we get, even with our students, and thank you, Amy, even with our students, that we get people of color or people of Latino descent or what have you. I think it's important that we are able to find a way to put persons like Toni and myself and others in front of these young people or in front of others because they trust us. We are part of their leadership team so that we can go in and, just like we're doing today on this Facebook or on this live, that we can go in and tell them, yes, we've been vaccinated. Yes, there is some side effects, but trust us that the side effects, the real effect far outweigh the small side effects, and so that we can go into central north or west high school and say to the young people 16 and 17 of African American descent or Latino descent, hey, it's important to find a creative way for us to even get them vaccinated. And I think we can then start to see an even larger population of people being vaccinated. And I just want to throw that out because sometimes if they don't see us, then they won't do it because they don't see anybody who looks like them getting vaccinated. Sorry, I just wanted to.
No, thank you.
I
We're
also
great.
have something to add.
Please
for
do.
1 minute, please. When they were talking, when I think it was Janet was talking about all the websites to get onto to sign up for your vaccine, that is another barrier for the Hispanics. Is they, number one, probably don't have a computer, and number two, half of them don't know how to use one or how to access anything such as click here, click there, click here. And if there could be some kind of a universal phone number that they could use, I personally myself went through KSI because I could call. It was easier. And they called me back within 4 hours and set me up an appointment. Just as a heads up, I know that, we don't make the calls, but if you would somehow set up a phone bank where they could call, and it would have to be somebody bilingual that could speak it in Spanish and English, I think we would have a bigger turnout in the Hispanic community.
And I agree on the African American side too. Thank you, Toni.
Yes, definitely. So we are committed to continuing these conversations, working on these access issues that we're continuing to identify and making sure that we're getting to where we need to be. So thank you both. We're going to stay in touch with you. We hope you'll stay in touch with us. And thank you to our partners who joined the call, our media partners. Again, this recording will be posted on our Facebook page as well as on our website. So you can find additional information there, as well as our follow-up news release that will come from Janet. So thank you to Toni and Pastor Perkins for sharing some of your time with us this afternoon on this important topic. And we look forward to bringing more information. And
I think we lost her.
I think I hit the wrong button. Thank you both.
Yeah,
Thank you,
go.
Toni. Thank you. I was so eloquent on my Toni and Pastor Perkins for sharing some of your time with us today. Look forward to talking with you all again soon. Have a good afternoon.
You too. Thank you.
Bye-bye.